Because
the vaccine is going to be available later this week for the general public. Is that going to be the nasal spray initially? And do you know how much of that will be coming in?
I don't have that data. I'll defer Paul. You may have that the data about what's coming in.
So Paul Biedritsky, Director of Disease Control and Environmental Health. So the question is the public cache of vaccine. We don't anticipate the public cache of vaccine, either intranasal or injectable, to be available for another couple of weeks. So yeah, it's healthcare workers only this week. We expect to receive another cache of vaccine for healthcare workers next week, including a fraction of which will be injectable. So intranasal this week, intranasal and injectable next week, again, focusing on healthcare workers in both private and public sectors. Afterwards, we anticipate receiving a large shipment of vaccine for public mass vaccination clinics.
And because those high-risk groups are told not to take the nasal injection, they're waiting for the actual shot. How is that going to work for those people? Do they need to get on a list when they can start getting that shot because they're still a high-risk group, but they're not supposed to have the nasal spray?
Well, I think that those high-risk individuals will have to utilize the same preventive measures that we've utilized all summer. As you recall, H1N1 occurred here in Milwaukee in the spring, and we've had to use preventive measures such as making certain that one stays at home from work or school, using good hand and cough etiquette, and if one becomes ill, seeking out the medical provider, and then those medical providers will make an assessment and use a cadre of antiviral medications or other things to treat them. We believe that those injectables will be on the ground, as was stated earlier, sooner than later. It is our hope, though, that we get healthcare workers, paramedics, and public health workers covered today to allow them to be able to push mass quantities of vaccine out in the coming weeks. This is a major undertaking. We'll need tens of thousands of individuals in Wisconsin pushing out vaccine to hundreds of thousands.
Can you explain the difference between the nasal and the injectable?
I have Dr. Swain.
Jeff Swain. I'm medical director for the Milwaukee Health Department. I have a little upper respiratory infection that's not influenza because I don't have a fever. But the difference between the nasal vaccine and the injectable vaccine, there's a couple differences. The most important difference is that the injectable vaccine is killed virus, so it's little tiny pieces of virus that are not alive and not able to cause infection. All they do is allow the immune system, the body's immune system, to recognize these parts of the virus so that in case that person is exposed to that virus in the future, the immune system is already prepared, those defenses are already built up, and that person can fight off that infection on their own. That's the same way that all vaccines work. The nasal spray is a live virus, but it's what we call attenuated, it's weakened. So there are a couple of other examples of vaccines that work in this way. Chickenpox vaccine works this way, measles, mumps, and rubella vaccine works this way. What that does is it actually does allow this weakened virus to cause a very mild infection in the body. But again, it's not a virus that is the same as a regular influenza virus, so it's not causing flu. But what it's doing is, again, allowing the body's immune system to recognize the same picture that it would see if it was exposed to regular flu and be prepared, build up those immune defenses so that in the future, when exposed, those defenses are there. So that's the main difference. The other differences are that some formulations of the injectable vaccine have preservative, whereas the nasal does not have any. But some formulations of the injectable don't have preservative either. So for people that are concerned about that, and there's no medical reason to be concerned, but I know some people are, they should look for either the non-preservative injectable or the nasal. Of course, some people are afraid of needles, so the nasal is quite good for those people. But the bottom line is, these are both proven vaccines. These vaccines have been around, the nasal for several years, the injectable for many, many, many years. And we've seen year after year these vaccines safe, these vaccines effective. And as Commissioner Baker said, they're made in exactly the same way, on exactly the same equipment, in exactly the same facilities as regular seasonal flu. These are not any different from regular seasonal flu vaccine.
Other questions?
Are healthcare workers required to get this?
Right now, this is a voluntary uptake of vaccine by healthcare workers. There's been some discussion of that nationwide, but it is voluntary. And it's our hope that healthcare workers will, who are eligible at this time, will take this vaccine as it's on the ground now. And then in the coming weeks, as healthcare workers who will be only eligible for the injectable version will take as much of the vaccine as possible here in Wisconsin. I did want to underscore the fact that the vaccine is on the ground and that it is ready to be deployed. And I'm going to take the first dose of the Milwaukee Health Department allotment. And our medical director also will take a dose of the nasal vaccine now. So we're going to have one of our public health nurses come forward, and I'm going to show how easy it is to take the H1N1 vaccine, and we hope that many others will follow.
If I might add, I'd also like to point out that it's all right to take this vaccine, even if you're mildly ill, as I am. So that should not be a reason not to take this vaccine.
What you've just witnessed is the administration of the H1N1 intranasal vaccine. It's safe, it is effective, and it's easy. And later this morning, we will administer hundreds of doses to Milwaukee Fire Department paramedics and other firefighters who are eligible, as we will do the same for public health nurses. So I want to thank you for getting this message out to the public. This, again, is the major undertaking, 41 years since our last pandemic, and now we finally have the #1 weapon in our toolbox to ward off and curb the spread of H1N1 infection on our community. We will hope to make announcements in the coming days regarding our public mass vaccination clinics. We will need the cooperation and support of many. But we are hopeful that over the coming weeks, Wisconsin and Milwaukee will be protected. Thank you so much.
Real quick, how do you feel? Do you have any burning or anything?
Oh, I feel great. If only every day could be this easy.
It's no burning.
It's no burning, and it's very, very simple and fast, as you saw. So I would think that all those who are eligible, I encourage them to pick up the vaccine. Thank you.